something to consider for men who like to drink. 1 in 5 men risk developing a problem with alcohol in their lifetime. That's more than twice the risk to women. It's according to a new broad survey of medical studies. The survey in the British medical journal The Lancet went on to say about 15% of men are at risk of alcohol abuse, while 10% are at risk of full-on dependence. Now, a lot of people say they want to cut back on alcohol, especially in the new year. House Call in January, as you know, is all about resolutions. This week, how to stop overindulging in alcohol and when it might become a problem. With us this morning is Dr. Tom Horvath, who is a psychologist who specializes in addiction. He's also author of Sex, Drugs, Gambling, and Chocolate. Welcome to the show.
Thank you.
You know, the study, I'm not sure if you read it out of The Lancet, talking specifically about men versus women. Why so much a bigger problem in men, first of all?
I don't think we really know. Perhaps as women get to an equal footing in the workplace, they'll drink as much as men do. Perhaps drinking is about male bonding or male competitiveness. But these particular statistics should not blind us to the broader observation that all human beings overindulge, and some of them just do it more than others.
If you think about overindulgence and you think about addiction overall, people talk about the fact that this is a disease of the brain. When someone becomes addicted to a substance, it's because they get some sort of feel-good chemical being released in their brain, and that's why they become addicted to a substance, versus just calling it a weakness of character, if you will. Is addiction a disease of the brain, or is it a weakness of character?
Well, there's some middle ground in there that I think people ought to think about. The problem with people asking themselves, is my addiction a brain disease, is that for most people, the answer would honestly be, no, it's really not that bad.
Right.
And the problem with that answer is that they then decide, I don't need to do anything about it. Rather, the question should be, what problems am I having in this situation with this level of alcohol consumption, let's say, and that would point to what I need to do about it.
Right.
And often there are changes that need to be made.
So following up on that, how do you know when it goes from just being what you might call simple overindulgence or even occasional overindulgence to being a problem?
Well, that's a question I encourage people to ask in a different way, because 4 drinks in a large man at a Super Bowl party across an afternoon is a very different experience than, say, a small woman having 1 drink just before a job interview. So you very much need to consider the context in which the drinking is occurring, and then you need to consider it in the context of the other balance points in your life. Ideally, we identify a crucial balance point, so many drinks, let's say, for a particular person in certain situations, and then stay within that. If you're not staying within that, then you need to take more direct steps to make changes.
These balance points, I mean, is there something that you sort of use as criteria in your job as a psychologist? I mean, when it starts to interfere with someone's way of life, or if they start acting differently, how do you know if someone is in your office that it may be a problem for that person?
Well, let's take a simple example, and let's go to weight, because it's easier. If I aim to weigh 170 pounds, and the scale starts showing me consistently that I'm above that, then I need to eat less. That's very simple. If, as a result of my drinking, I'm interfering with activities and goals that are valuable to me, that's a sign that my drinking needs to cut back. That's a very personal decision. I've had people come to me who want to stop drinking 1 or 2 drinks a night because they feel it interferes with their capacity to communicate effectively with their families. So that's a real issue.
Really quickly, we've just got a little bit of time. What are some tips? I know this is a hard question to ask at the end, but what are some simple tips you might offer our viewers?
Well, 1, start with what you like about what you're doing. If you like to drink because it's relaxing, you need to learn other ways to relax. Also think about the big picture. What are the real important objects and goals in my life? My family, my kids, serving God, doing a good job. That sets a context in which overindulgence doesn't really fit in. If you need to get outside help, and some people do, then consider the self-empowering support groups, such as Smart Recovery or Moderation Management, which have a very different approach to recovery than Alcoholics Anonymous, AA, and are more suitable for most people. Similarly, if you're seeking treatment, then consider a self-empowering approach. In the United States, treatment is dominated by the AA-based approach, but if you just do a little internet searching, say for non-12-step treatment or alternatives to AA, you'll find other approaches as well.
A lot out there. Tom Horvath, psychologist, thanks so much. This is an important topic to our viewers. Thank you for being with us.
My pleasure.
All right, now you want to know a surefire way to lower your cholesterol in just a few weeks? Well, stick around for my Ask the Doctor segment. We're going to have that later in the show.